BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
Allergy season is upon us, but how do you know if your child has hay fever or just a spring cold? Our health specialist Leah Sarich is here now with how to tell the difference. And
it's a tricky one.
Yourself, it can be difficult.
Absolutely, and so we had to look at this when it comes to the children. But the bottom line is that hay fever or seasonal allergies very, very common. 30% of the population is dealing with this right now, so it's pretty common. But what about the children? And this is where it does get tricky. So I spoke with allergist Dr. Joel Doctor about this, and he explains when and how hay fever starts in kids.
Young kids can develop hay fever, but they typically don't start to show symptoms of hay fever under 4 years of age. And that's because it simply takes, a few years of exposure to pollen in order for their allergy-prone immune systems to start to develop antibodies against pollen. So they don't start to do it till about 4 years of age, and then after that, symptoms can be kind of mild and start to ramp up during early childhood. Usually it starts to really kick in during the teenage years.
Okay, so that's when it really starts to kick in, unless you're my little guy, in which case he's got it pretty bad already. So now what do? Your preteen has a runny nose, watery eyes, but is it a spring cold or summer cold, or is it hay fever? So parents need to be able to figure this out, because we, just like doctors, need to figure out the diagnosis so we can do the treatment, right? We want to help our kids feel better, but we want to make sure we're giving them the right medication. So we need to know what's going on. And that's really the goal, Dr. Doctor says, when it comes to kids and hay fever, is to treat the symptoms properly so the kids can get back to normal, just being kids outside, doing their thing, playing soccer, going camping, what have you. So Dr. Doctor says there's one telltale symptom that will help you tell the difference.
One of the cardinal tip-offs that it's an allergy as opposed to a cold is itch. Individuals with hay fever get very, very itchy eyes, itchy nose, sneezing. It tends to really dominate the picture. With colds, it tends not to be so itchy, so that'll be one really good clue. And the other is timing. If it's the same symptom complex, itching, sneezing, runny nose, the same time of year, year in, year out, that is likely allergy. And lastly, it can be correlated with the pollen counts. So you can actually check on TV or Weather Network and see what the pollen counts are. If you have typical symptoms, when the pollen is very high, it seems to occur every year, that's almost certainly hay fever.
So there you go. Well, that's the big factor. So the itch and the timing and all that kind of business. So if your child has that itchy nose and the itchy eyes, you know it's hay fever and you do want to treat it accordingly. Now the good news is it's quite simple. So if the symptoms are mild, any over-the-counter antihistamine should work. And Dr. Doctor says they're all really very safe and generally very effective.
Right.
Now, if that's not working, if your child's symptoms are a bit more severe, then you want to talk to the family doctor. And then you're going to look at things like prescription strength nasal sprays and eye drops. And those are things that you want to take on a very regular basis. Right. If the symptoms are mild and you're just taking those over-the-counter histamines, you can take those as needed. But if it's more severe, you want to be very consistent with that prescription medication, those prescription nasal sprays and prescription eye drops. Now, if you're looking at a very, very severe case, so all of those options are not working for you, then you want to talk to your family doctor about a referral to an allergist, because then it might be worth exploring more intense options, things like desensitization. So that can include things like allergy shots, or there's even what they call a sublingual tablet, which goes underneath the tongue, and that can reduce symptoms by about 30%. But those both are big commitments. They require a lot of visits to the doctor and that kind of thing. So it's worth exploring with your doctor what the options are.
What about actually just trying to keep your child away from the factors that are...
The trigger avoidance, yeah, that's a really good option. And like Dr. Doctor mentioned in his clip there, there's really good resources online. If you go to like the weathernetwork.com, they actually have the pollen counts right there. So you can see, is it going to be a really bad day? So for example, if it's a really bad pollen count day and you know there's going to be lots of pollen going around and it's hot, it's dry, it's windy, those are the kind of days you're looking for, maybe that's the day you don't go to Callaway Park and that's the day you go to a movie instead. Right? So you can make those choices and keep that in mind, because those are really good resources, and I'll have links to those on my blog.
But those that suffer, I know my husband does, it's really
a pain.
It's a tough time of year. More information on your blog, breakfasttelevision.ca.